Feeling fearful, anxious, overwhelmed, or powerless is common during times like this. That's why addressing the psychological impact of the COVID pandemic has been central to Kentucky's response effort. And that's why I am so pleased to announce that our department received a $2 million federal grant to increase crisis intervention, treatment, and recovery support services within our public behavioral health safety net. These funds will support 3 major activities. First, because healthcare professionals on the front line of the epidemic are facing unprecedented physical and psychological demands, we know addressing the resiliency of the healthcare workforce is vital. To that end, we're working with psychological trauma experts from the University of Kentucky to provide targeted support to healthcare organizations and healthcare professionals. Second, while certain groups are at particular risk for increased stress and anxiety, we know many who have no history of mental health problems may begin to experience symptoms due to stressors such as increased financial strain, social isolation, or just the general fear and anxiety associated with the potential for contracting COVID-19. Our Community Mental Health Center network will receive funding to support expansion of crisis response services to meet the expected increase in individuals experiencing mental health crisis. We also know that individuals with serious mental illness are particularly vulnerable during times like this and may require more intensive levels of care. Therefore, some of these funds will be used to expand crisis service capacity for these individuals, as well as provide transitional housing and behavioral health services for those being discharged from our state psychiatric hospitals. Finally, this funding will also allow us to reach out to another vulnerable population, the homeless. We will conduct behavioral health screening, assessment, brief intervention, and treatment of individuals who are homeless or unstably housed and reside in temporary shelters in Jefferson and Fayette counties, where approximately 46% of the state's homeless population reside. I believe these strategies will complement our existing efforts to mitigate the psychological impact of COVID-19 crisis on Kentuckians. In the words of our governor, we will get through this. We will get through this together.